Welcome to Bite Size Dental Marketing. Today I have Saskia with me. Saskia, thanks for jumping on with me again. It's always a pleasure.
Thanks for having me today, Eric.
Yeah. So I know that you guys got through the 2022 phone calls of listening for all the practice. What are you hearing on 2023? How are the calls going this year?
In 2023, we're hearing that more practices are becoming a fee-for-service type of practice. This is meaning that the receptionists now are needing to really sell a practice in terms of what makes them different. Are their services greater? Do they have a wider variety? Or do they have different specials that they can offer?
Yeah. Now, I think most of our practices, I think everyone but one, in fact, is dropping insurances to some degree. Stylistically, when you hear the receptionist and the front desk answer the phones, how do you think the front desk is handling them? Are they more curious? Because I know you mentioned selling, but what are some tactics you hear? And the other question is does it feel to you that the patient or the prospective patient really understands what accepting dental insurance means versus not accepting it means?
I think a good call, the receptionist has patience and they're able to explain to a caller what makes them different, as well as you said, they're able to explain what taking insurance means versus not taking insurance and where the prices will differ. And I think it all boils down to a receptionist understanding the nitty-gritty of a practice, and whether that practice stands out and how they do stand out. Mm-hmm. And the specials. I mean, a lot of the time, practices have specials on their website that the front desk staff are actually unaware of. And sometimes callers call in and identify these specials, but the receptionist ordinarily would not promote them.
Mm-hmm. One of the things that I've heard, and I've certainly not listened to as many calls as you have, but when I do listen to the fee-for-service versus PPO calls, one of the things I'm struck by is because the front desk answers the same question day in and day out, they seem to assume the caller has knowledge of what being out of insurance means versus in insurance. And I do find that there's a lot of misconceptions around marketing and operations. The best practices we have answer the phones really well, and that creates a scenario where the marketing dollars go further. If they're converting, 2 or 3 more a week, that is really meaningful to what I'm going to call the KPIs of marketing, because we look at the cost to generate a call, we look at the cost to generate a patient. And if the front desk is able to convert a higher percentage of them, that we can hear, that really takes the marketing dollars further, where the opposite happens if they're poor on the phone or they're not converting as well. Inevitably, you're almost better off not spending money on marketing and focusing exclusively on the front desk.
Yeah. And training them up. I mean, ultimately, the front desks are the first contact that a caller is going to get to the dental practice. So before the caller has even met the dentist, they are already communicating with the receptionist, and they can get a feel for what the dental practice is going to be like overall. So it's really important for, a receptionist to be more than just someone who answers the phone. It's lovely to hear a receptionist that actually cares about a patient. Existing patients that call to have to follow up or schedule a follow-up appointment, and they've just been at that dental practice. Maybe a week ago, they've had treatment, and the receptionist answers and says, "Oh, how are you doing? How did the surgery go?" And that just shows it's more than just someone that's going to schedule an appointment. They actually care about the patient.
Yeah. I find that the front desk is probably the most underappreciated, but the most powerful when it comes to not just scheduling, but the overall presence of a practice. I find that certainly when the patient comes in, the hygienist and the doctor really matter, the chairside assistant really matter. But like the first impression is the front desk, and it's just people just assume that, someone who's answering the phone is answering the phone, and it really has a powerful impact. Yeah.
Yeah, calls can be shut down very quickly with a front desk staff member who is just there to sit in the chair and answer calls and doesn't really, care about much else.
Yeah. Now, I've been hearing the reports that you generate to our clients, and, what are you hearing as some common problems on the phone not related to the insurance question?
I also sometimes hear calls where a receptionist picks up and they're still having a conversation with someone else in the practice, or they're laughing at something, a joke that someone else made. And, this is what the caller hears. And I think that's quite unprofessional.
Mm-hmm. Mm-hmm. Yeah. Now, are you hearing certain times of the day, or are you hearing if you had to, is there time of day or day of week differences that you hear when you're listening to calls?
Leading up to closing time, that's where we hear quite a few voicemails, are leading up to when the office is closing, around like 4:30 in the afternoon, leading up to 5 p.m. if the dental practice closes at that time, and around lunchtime. We find voicemails, that's when the majority of voicemails occur.
That's really unfortunate, because that's when we statistically see high intent patients calling because they had their lunch break, or because they peeled off of work a little bit early to call and make the appointment. That's quite unfortunate to hear, because that is the prime time that high intent patients are trying to call the practice. Yeah.
And that's when you'd probably get significant new patient conversions.
Mm-hmm, mm-hmm. Yeah. Yeah. Well, Saskia, thank you so much for taking the time with me today. It's always insightful and amazing. And that was your bite of dental marketing today.
Thanks for having me, Eric.
You bet.